Ladies and gentlemen, please welcome to the stage David Rubinger, Market President and Publisher, Atlanta Business Chronicle. Matt Reed, CEO, Georgia CEO. Andy Miller, Correspondent, Kaiser Family Foundation Health News. And Jane Morgan, MD, VP Medical Affairs, Hello Heart, and medical guest, expert on CNN.
Hello and welcome to Health in Media. So we're going to just jump right into it. We have really an excellent panel, and I'm going to give everybody a chance to just introduce themselves. I want to start right here with Andy Miller, who's the correspondent for the Kaiser Family Foundation Health News.
Andy Miller. I've been a healthcare journalist for 32 years. I thought I'd only do it for, 6 months or something, but here I am. I worked with the AJC until 2009, and then we formed Georgia Health News, a nonprofit. And 3 years ago, it was taken over by Kaiser Health News, which is now KFF Health News, and working as a correspondent for them now.
Yes, good to be with you. Matt Reed with Georgia CEO. We're an online business news publisher. We have 13 different newsletters and websites across Georgia. We reach over 74,000 people with our newsletters each morning, and we started in Albany back in 2010, and it's been great to be with you, and also have a wife who's a director of nursing at our local health system, so I get to kind of see a little bit of both sides. So glad to be with you.
And I'm David Rubinger, Market President and Publisher of Atlanta Business Chronicle, and was formerly the editor of the Chronicle back in the 90s. Took 16 years out of the media business, came back because it's such a fun business to be in, right, guys? Again, Market President and Publisher, what does that mean? It means that it all rolls up to me, but the editor reports to me, advertising reports to me, events report to me. Business Chronicle, I hope you all subscribe. We're one of the leading news sources for business news in Atlanta and around the state. I would have loved to have hired Andy Miller a long time ago, because Andy Miller was he was the standard bearer of healthcare coverage in Atlanta. He did such an outstanding job at the AJC and at Kaiser. But our whole mission is how can we help a business grow? How can we help you as business people grow through whatever lens possible? And if we're able to provide that type of data and information and news coverage and events that shine that kind of spotlight, we're doing our jobs right.
That's wonderful. And I'm Dr. Jane Morgan. I'm serving as the moderator today. I'm a cardiologist, actually, and I'm the Vice President of Medical Affairs for Hello Heart, which is a digital health company. But my other job is I spend quite a bit of time in media. I'm a medical expert for CNN, for CBS, for Scripps News. I do a social media channel. I have a social media podcast that's called the Stairwell Chronicles. Every Wednesday, I sort of post 60 seconds of the Stairwell Chronicles. It's just a little bit of medical information that you digest in just 60 seconds. So if you log on to any of my platforms today, you'll see that I posted something today about hypertension and menopause. 60 seconds, just take a moment to listen to it. So we are representing really a lot of the different areas of media and what that means and how media may or may not be influencing not only healthcare, but healthcare decisions. And so I thought maybe I would start with you, Andy, and just ask that question. How is media influencing healthcare decisions? Should we be? How are we?
Well, I'll give you a couple of examples. One is over the years I've written about open enrollment and given tips to consumers. And we all get these enrollment packets if we're in corporate healthcare or whatever. And we're probably, the people in the room are probably pretty familiar with these terms like what is a deductible, what's this network stuff, what's the formulary, whatever. But over the years, I've done several open enrollments stories where we give tips. I mean, here's what you need to know. Here's what you need to steer clear of. What's a deductible? All of that. And I think we've helped people understand what they've got in their packet. I mean, open enrollment's very difficult for a lot of people to comprehend and make the right choice. I also did a radio show on GPB about how to pick a nursing home. Like if you have a loved one, where do you go to get information about the area's nursing homes? If they need that care, it's very important to know where the quality ratings of that particular facility. It's important to talk to the residents and the staff and to know whether it's rated highly or rated poorly. So I think in those cases, we can give consumers, regular people, information where they can go and make good healthcare decisions for themselves and their families.
It's awesome, Matt.
Yeah, so I think from our perspective, we cover a lot of the coming and goings and interviewing some more of the administrators, but also do some frontline providers. And I think that's something that I think from my Davis perspective that we would like to see more of instead of who's moving here or there. Talk to us about your specialties, and you're saying tips, and I think that's something that I see health systems and communities doing more on social media mediums, but I think more so that from a media perspective, whether it's us, the Atlanta Business Chronicle, Georgia Health News, the AJC, I think there's definitely more bandwidth there that we can help maybe shine a light better on what you can expect as a consumer, but also those tips that you can take with you and to better improve your life.
Excellent points, both. The thing that I see happening with our reader is they're caught between messaging that comes from the insurance providers and the healthcare providers, and they're caught in the middle. And they're trying to figure out how to make the right healthcare decisions, not only for themselves, but for their employees. So our role in this whole thing is to help them sift that out as best as possible. If we're able to give them the types of information, factual information that make them make advised decisions towards how to implement a better health plan for their employees so they have better productivity, that's an important part of the message that we try to deliver on. So while we're not doing the amazing things like Dr. Jane's doing with giving personal tips on how to maintain your health, we do give the hospital systems and we do give the insurers the opportunity to get those messages out in a broader way to help get our readers to feel the confidence that they're going to be able to help them on those delivery platforms. But it's complicated because one of the things for us is, as a business newspaper, we're trying to figure out a way to write things in a way that our readers will want to digest the information. And if we get too wonky, they walk away. So we have to figure out a way to make it digestible, make it real, and make it as direct as possible.
And so what I'm hearing is a lot about messaging and health literacy. And, from a different perspective, it's also what I do oftentimes when I'm on television. How am I going to get this message across in a concise manner? Sometimes I have a limited amount of time, especially if it's live interview. Whatever you say, you've said. Do you need to take time to retract it? That's just eating into the seconds that you have to deliver your message. And so how are you actually going to give that message, make certain people understand it, and they walk away with a little bit of knowledge and understanding of what the landscape is, which is very different from when you are recording and it's going to be edited. Oftentimes you are able to say whatever you say, and you can speak in long sentences and it will be edited, but the risk of that is it can be edited and maybe it looks as if you've said something that you haven't said. And so it's always important to make certain that you understand what medium you're using and whether or not that message is being conveyed. You can spend a lot of time talking and a lot of time writing and not really say anything. And we want to make certain at the end that the public actually has that information. And so, what I would like to say, oftentimes things are going on in the community of which the larger public may be unaware. And here you all have an opportunity to shine a light on what's happening in the community that really may be of interest to people if they knew about it, if they understood it. How do you approach that?
Well, I'll give you two examples. One was a story that Georgia Health News combined with WebMD to talk about ethylene oxide. And it's a cancer-causing chemical, but it sterilizes half of the medical equipment in the U.S. And there happen to be a couple plants here in the metro Atlanta area that basically the neighbors in these communities to these plants had no idea what was going on within those walls. Well, this is a cancer-causing gas, and oftentimes it would emanate from these facilities into the communities. And they were totally unaware, and what we did is we shined a spotlight on that and what the state was not doing in terms of regulating and keeping these emissions down, and also just informing those communities about what was going on because they had no idea. Another one is we're working on now is a story about children living in extended stay hotels. And what does that mean? It means that there are thousands of kids who are growing up in very cramped, crowded rooms, environmentally unsafe. It could lead to allergies, asthma. There's insect infestation, and there are mental health implications too, because oftentimes they witness violence in those particular hotels. And so there's another example, I think, of something that very few people know about, but we think it's important. It's important for children's health.
Well, for us, I think the strength of our network, while we have an Atlanta-based publication, is the strength of our rural network that we have in our other cities. And so, for instance, in preparing for this, I was looking at some of our data and analytics. And so in August, we had over 200 articles with the word health in them. And that's about as deep down as I got. But it showed, and the couple things that I remember is where, there was a heart walk that St. Joseph's was doing in Savannah, or in where I live in Albany, Phoebe Putney, they just opened up their new $50 million Living and Learning Center, their partnership with Albany Tech to help, solve some of this healthcare nurses and shortage and healthcare workers. And so you see all things like a series that we've done with Piedmont Columbus Regional, just with their different providers. And it's almost like kind of like a one-on-one series to, keep talking about different specialties, whether it's, we had, even though we're a business publication, they sent us somebody who was talking about bariatric surgery, and so on a business publication, that's not kind of, as you said, David, we might lose some people from that, right? But, that's who they wanted to send that day. And so I think that when you talk about getting the news out there in all of these smaller communities too, there's a lot of times there's not a place that people are digesting that and see that. So I know I'm proud that in some of our smaller communities, like in Tifton, we have a Tifton CEO publication where a lot of the things that like Southwell puts out, that we might be the only person that's actually putting those out on the internet, and so that the local paper that might only publish a day or two a week. We're able to get that to them, usually the day of or day after. So I think it's just continues to be important to have those outlets in healthcare too, to be intentional about putting out those messages, even when there's the audience might not be there, but there's so many different ways, whether it's through one of our publications, through social media, to get your message out there, and it's just important to continue to do that.
So, looking at everything through the lens of economic development, you look at a story like Atlanta Medical Center, and obviously heartbreaking for a community to lose a major hospital. But we looked at it from a slightly different lens. It wasn't just that a community was now going to be totally underserved, and how are we going to rescue that? It was also, what is this going to do for the impact on the business community, on the convention business? So if you're going to bring the World Cup to Atlanta, there's an expectation that, God forbid there's ever a catastrophe, you need to have the healthcare network that's going to be able to support that. When you lose one of your major hospitals in that same area, there's a lot of concern that goes well beyond simply the healthcare of that immediate community. It's going to the lifeblood of serving those people. So what we've learned is the economic impact of the healthcare community throughout Metro Atlanta is vastly understated by a lot of the media. People don't understand how many people it employs. Piedmont tells me that they have more employees in Georgia than Delta Airlines. It's just one of those things that is not necessarily recognized. Wellstar's network is tremendous. Each of these systems have great stories to tell, and they're constantly trying to get us to write about them, and we don't have enough time or resources to cover them. But when you look at the economic impact of when a hospital goes away and what you do to recover that, that becomes a huge story that goes beyond simply the individuals in those communities.
And so, what I'm hearing is that it's so important to be able to represent the community, to inform the community, which means you have to be able to build trust. So the public or the people who are following you or reading your words have to be able to trust you before they even come to you. And so what is that brand? You all have built a brand. And what is that brand awareness that allows people to say, here's where I can come for really relevant, accurate information? Sometimes I think within our politically charged environment, I have been in interviews where I've been asked questions that had a political bent to them, or maybe were at odds with political leaders, and I've had to kind of dodge and weave my way through it to try to keep it scientifically on track, regardless of whether the anchor or the interviewer is really trying to get me to talk about politics. How do you guys manage that when maybe your coverage is at odds with either politics or political leaders? Do you just dive in headlong, or do you try to dance around it? I'm the dancer, but how do you guys manage that?
Well, I don't dance, so let's take an example of Medicaid expansion, which there's 40 states that expanded Medicaid under the Affordable Care Act, including some Republican-led states. Well, Georgia is not one of them. And so if I'm writing about access to care or the uninsured, I will mention the fact that Georgia has not done this. I'll also probably put in the fact that Georgia could actually save money on Medicaid if it took the incentives to expand the program. And we're talking about hundreds of thousands of people getting coverage. Now, the Republican leadership, the governor especially, does not want to do this, and I will get a comment from them. But it would be, I think, irresponsible for me not to mention in a story that has access to care issues the fact that Georgia could be adding a lot of people to Medicaid and saving money in the process. So I guess that's an example. I mean, I will give them their shot in terms of explaining this is why they don't want to do this, and okay. But again, this is an important issue, and I'm not going to dance. I'm going to go after it.
And that's why we have all of these perspectives. We need people who are going to address it in different ways, right? That's how the media is influencing health.
So I'll say through us, so what we're known for is kind of our thought leader videos. And when we were started back in 2010, we wanted to have a controlled editorial process in Albany where we started. That there was all sorts of, Dr. Morgan, as you mentioned, snippets and things being cut up, and I would say maybe a tad bit of misinformation before that term was even something. And so when we started Albany CEO, we had an approval process for our videos. Now that's a little more lax, but it goes back to that trust factor. When you're putting somebody on camera, or you're talking, or your writer's talking to somebody, or you're just myself just talking high level with other organizations or other CEOs or business owners, you want to build that trust and know that that you're in the same boat together and you're rowing together, and that what they're talking about is a positive message. We're all about positivity at Georgia CEO, and we try our best not to focus on all the negatives or leave the investigative and things like that to others. But so I think you have to build that trust, and with your platform and with your own organization, have those messages that you're confident in pushing out there.
So this is complicated in a way because I believe that media has really lost the discipline of being able to divide editorial content from sponsored content. And by not having that discipline, oftentimes influencers, it could be political, it could be business, weigh in heavily on what the editorial process is, and that changes, it rocks the boat of what the editorial content is designed to be. That's what it's there for, is to maintain independent, clear information that is delivered in a concise way. But once politicians, business leaders, economic development people start weighing in and saying, well, you know, we're investing heavily in your product and we believe our message should be heard loud and clear, more loudly than the other side, then we have a problem. And the problem, luckily we have 3 outlets here that don't play that game. Unfortunately, a vast majority of the media landscape is more than happy to sell their pages, sell their websites in a way where it's not clearly labeled as sponsored content, and using a term that's used constantly in our newsroom, pay for play. If something becomes pay for play, then suddenly the influence muddies the journalism, keeps it from being valid, and the reader then has to decide for themselves, and I recommend everyone do this in this room, whenever you're reading something, pay attention to whether or not the content is being reflective of someone who's sponsored the page, because you know that it's influencing what's happening on the editorial page. It's the greatest challenge that all media faces right now, because we're all fighting tooth and nail for revenue. We have to find our revenue sources so we can pay journalists, so we can pay everyone in our staff. So that's the challenge. But what we try to do at the Business Chronicle, and I know these folks do the same, you got to maintain the discipline. You have to be able to stand up to an advertiser, stand up to a politician and say, no, the reason why we exist today, the reason why the Business Chronicle has been around for 45 years is because we haven't fallen prey to giving over to someone who's paying for our content.
And you know, when we talk about sponsored content, that really is a big issue. And it's a big issue as well on social media. And all types of opinions as well are there. And there are lots of people who cloak themselves in a lot of degrees and credibility that actually don't really make sense for the people who are inside of the system. So we know that that's not a real school. We know that that's actually not a degree you can have if you just said, you know, X, Y, and Z. But it sounds very official, and, you know, thousands of people are following along. And so it's really hard sometimes to debunk that. And it's the same thing as taking a deeper dive and trying to find out what's sort of behind that. And it's very difficult oftentimes for just the general public to figure it out, whether in traditional media or social media. When we look at where media is going in the future with regard to health, and whether or not we will be more of an influence, less of an influence, influencing in the same way, at odds with healthcare. What is it that you see when you look out into the future as to where this may be headed?
Well, historical perspective here. You know, I grew up in an era where people had newspapers at the bottom of their driveways. And now you drive through neighborhoods and it's no longer the case. I mean, it's not to say that newspapers don't exist, and they're doing a great job. But local, smaller outlets are contracting, whether it's staff, whether it's actually the thickness of the paper. And as a result of that, a lot of nonprofit news organizations like KFF Health News, like Politico, Axios, ProPublica have cropped up. And the key for these organizations is to drive readers to their content. And one way they can do it is just through credibility. And it's not the easiest of tasks, but once you start getting a following and have partnerships with other media organizations, you can make it work. But it's no longer in the print game. When I started, it was all about print, and now it's transformed. And a lot of it is nonprofit health journalism. And so that's going to continue. And it's going to continue. There's going to be new websites popping up, some of which will be less credible than others, but some will be really good. And we do have some right here in Georgia that are doing a really good job.
And one thing about print is that everybody's reading exactly the same thing, exactly the same words. And so that's the beauty of that, is it's not malleable. So.
Yeah, I'd agree, Andy, that having different sources, sometimes with the same content, sometimes with not. But it has been amazing recently that there has been a number of things that have popped up. But I still believe in the paper. I still get my paper. It's 3 times a week in Albany, but I still get it every week and pour through it. And so I think that also, as you look at the kind of the changing landscape, I know from a video perspective of ours, what is kind of the new next maybe technology or to get more messaging out. I mean, our director of photography, just yesterday we were doing a project here in Atlanta, and he showed me with how AI is just. I will admit I'm not the most in depth on AI. I listened a lot earlier in one of the panels, but it just blew my mind. Some of the things that you can do with that, and so when it comes to a video perspective, and so I think that continuing to have those trusted resources and news outlets, and also giving that opportunity for those to share their story, whether it be small or large, and continue to educate the public is just so important.
So I look at the lens of the current media landscape through the eyes of my children, who are all in their 20s, and I see how they digest information. They're very successful, college educated, doing great in life. They're not reading the newspaper. Will they maybe grow into the age where they're going to read a newspaper? Maybe, maybe not. But I look at it through their lens and realize we need to figure out a way to solve for that problem, that their ability to get information from Instagram first, so going through the visual first and then working their way back to the written word, the media has to keep on solving for that, because we're not going to change. We can't put that genie back in the bottle. That's happened. Print, I love our print publication because it is a place where people can at the end of the week, if they've been on the road, they can digest the information they need. But guess what? We're only putting, I don't know, maybe half of the content that we create ends up in the print version. The rest is published online in a daily email format, because we can do more there because we don't have enough print advertising to support all that. So we're just having to continue to evolve and get smarter on it. I totally agree with Andy about the biggest fear I have is the news deserts that exist. Just like we have health deserts around the state, we have news deserts around the state. The inability to be able to deliver clear, accurate, concise information that is not influenced by foreign, and I don't mean other countries, foreign influences that are propagandizing what's going on in the healthcare community. We're fighting a tidal wave of bad information that comes in through nonprofits, through a business journal that has, we have 30,000 subscribers and a couple 100,000 readers. That doesn't cover the entire state. We'd love to, but we can't do it. So we need people in this room to help in that advocacy piece to make sure that they keep those bad actors at bay, stay active with your local media, help continue that dialogue and keep it going forward. But it's very complicated right now because of the way media is being thrust onto younger people today.
And you brought up a good point. So really, at this point, people in their 20s are all digitally native. They've always grown up with that. I mean, it was really an excellent panel on this right before ours. And how do you provide that newsworthy information to maybe a big generation gap? Depending on how well you are or not keeping up really with digital technology. And so when we come to social media, you are correct. Most of the information is consumed there first, and then maybe working backwards. And, we all know how social media works, and you look at something that feeds you more of the same thing and continues to reinforce whether it's positive or negative or right or wrong. And so it's really, really up to the consumer to digest what they know to be true. Most people digest what they find to be entertaining. And they hope it's true, or they forget that they were supposed to be looking for the truth. So, social media is great. I'm on it. I post a lot of things. Hopefully, if you all are following me, you find that it's all true. But Other people may not, or they may be posting their version of what they think to be true. And so this digitally native generation has grown up with that, and that is their new normal. And we have to find out, how do we continue to make certain that these local issues that are right here in your backyard, as opposed to the internet can bring the whole world to you, how do we make certain that the local issues are also relevant and we understand how they're all interconnecting? And so when we think about that, how do you leverage your power, your brand, to make certain that you are bringing the stories that people really need to hear?
Well, it's different platforms. As I mentioned, I started out in print, and there wasn't this is pre-internet. That's like 100 years ago, right? But a couple ways. I think as a reporter, you have to be able to adapt to what you're talking about. So whether it's Facebook or in my case is radio, and I will do this weekly on GPB stations, the Georgia Health Report, and I'm astonished that people recognize my voice in a store, and so it's important to embrace new forms of media. I did a story recently about hypothyroidism, which I have, and talked about the number of people who do not get help by the standard therapy, which is a pill, which I take once a day. And my bosses were interested in doing it also as a first person, and they did this beautiful cartoon of my experience. And I said, okay, I'm not a cartoon character, but it worked. And they posted it on Instagram. 1.5 million views in the first couple days. So, that blows me away. But somebody like me that's, like I said, print was the only thing out there. People like me who are aging a little bit need to embrace new forms of communication to get the truth out in whatever form of healthcare it is.
And I'll say being online, and I will say I also subscribe to the Atlanta Business Chronicle, so I get that weekly. So my local paper, Atlanta Business Chronicle, but being a completely online publication, leveraging the social media. I would say more so in the last year or so, we have refocused kind of our social media efforts and get a lot of traction from like LinkedIn, Facebook. X now, somewhat from we've dabbled in Instagram, but we're not. We might get 1% of 1.5 million, maybe not even that much. So that, trying to push all of the content you're putting out there and leveraging the feedback that you're getting. We do a pretty exhaustive reader survey every October, and health from a healthcare perspective, that's always either 1, 2, or 3 of what our readers are telling us they want to hear more about. So that's always, when you think about that, as encouraging, and you talk about when your community's leveraging that for good. I think one of the best things, I'll use myself as an example in Albany, is the Georgia CEO network that interact with a lot of different people, as we all do, but seeing those things that are going on in other communities and bringing that back to my community, wherever anybody is here in this room's from, seeing things in those connections, right, and getting engaged and being all in on continuing to drive that forward. So I think that we all can play a part in that, not just the media, but everybody in this room and in your own individual communities.
I'm going to go back to the word discipline again. We do what we're good at. Clearly, when it comes to social media, we know what our readers' tastes are, because we're writing to our existing and growing readership base, but they're not necessarily Instagram first at this point in their careers. LinkedIn, most definitely. We feed almost everything we do through the LinkedIn platform, because LinkedIn has become such a ubiquitous place for business community and interact. So that's been great. But you're not, and a little bit of Facebook, but Facebook's sort of fallen off a little bit as well. So I think, same with X. a little bit of X, but we're not going to invest heavily in all these various social media channels to see if it sticks. We know enough about our readers to know where they're going to go. So we're pretty disciplined about that. The other thing is a driver for our newsroom is very much about the biggest difference for especially for Andy and me growing up in the business. When we were young journalists, we cared about one audience, and it was our editors, because they were the ones telling us good, bad, rewrite, and then where the story appeared in the paper, an editor's decision was your way of getting a pat on the back as to whether or not you did a good job. My newsroom's totally different now. These writers can see on a moment-by-moment basis how many page views their story gets. They can track how deep people are reading into said story. They can also see on a regular cadence how many times a story they wrote actually led to someone saying, this is such an important story, I want to subscribe to Atlanta Business Chronicle because we have a paywall. So if a story is that important, someone is willing to invest the subscription fee, that shows it has a certain degree of urgency. So a young writer now has a whole different metric for what is good performance. Yes, they still have an editor, and that editor still has an influence on their careers and growing, but they have all these data tools going on in the background that change everything. So they're becoming more social media savvy because they want to make sure their stuff gets more page views, because it's going to reflect in their job performance. Very different way of approaching it. And again, this is where the discipline has to come in, because if you have a writer who gets so caught up with their social media hits, they may start to stray away from quality because, well, it's more important that I get the page views and get the conversions than it is for me to do really high quality journalism. So that's where we, as the managers of said news operations, have to make sure these writers are staying focused on the end game, which is quality.
And, that's so important. And, I'm from the sandwich generation, so I'm in between digitally native and newspapers. I remember newspapers. I liked newspapers. I remember reading them, especially the Sunday paper. There were areas that I liked. I read the funnies, the cartoons. I remember growing up with newspapers. But I'm also in this digital area where I've really had to work in a digital area, a digital era of making certain that you can perform at work and you understand and you can manage all the different tools. And so when we think about where, let's say for you, Andy, Kaiser Family Foundation Health News is going, what do you see next for Kaiser Family Foundation, especially for someone like me who's a sandwich generation? Like, what's coming next?
Well, I think one thing that we do that I absolutely love and think is great is we partner with bigger, like, news organizations like CNN.com, USA. I mean, we just did a story on the school shooting up at Appalachian High School, and we looked at it from the mental health point of view. And that got picked up by CNN.com and the AJC. So I think through partnerships, we're able to spread what we do. And our content is free. I mean, free. There's no cost if a media outlet wants to run it. So I think that's where we're coming from. I think new platforms like Instagram, we're doing more video work. And clearly radio and podcasts are something that we do. So I think not only do we do the traditional story that will get picked up by NPR.com, whatever, but we're looking to go out in other forms of media to reach people. And I do worry about the 20-year-olds and the people from 20 to 30. Where are they getting their news? Are we reaching them? We know we think we're reaching, I'm speaking of all of us, the media people in their 70s and whatever, I mean, they know where to go. They might go to NewYorkTimes.com or whatever, but I wonder where the people 20 to 30, where are they getting their news?
Matt, Georgia
I
CEO?
have a 5-year-old, and I can't imagine what it's going to be like for her. So no, for Georgia CEO, I think for us is just continuing to tell those stories. We hope we have again 13 communities across Georgia. Have been able to from our model to make both small and larger communities work. So I look forward in the coming years to growing the number of cities and mostly more smaller rural communities where we can hopefully make an impact by telling those stories and giving organizations an outlet to tell their story. So looking forward to that, and just I think, as Andy said, continuing to leverage other mediums to try to reach more folks. I mean, that's who knows what's next.
And David, Atlanta Business Chronicle, what do you see on the horizon?
So the horizon's great in terms of we know we have this untapped potential to cover the healthcare community in Metro Atlanta and throughout the state. I feel like we're still trying to figure it out. Again, with so many health systems telling so many interesting stories, there are plenty of opportunities for great storytelling. There's also the opportunity, whether it's from the public health side over at CDC or in the nonprofit community, all the healthcare nonprofits that are in our city, we have plenty of storytelling to do. The key is to find a way to get our business community to connect with those stories. Right now, most of the health systems do native content. It's advertising with us, but it really is very purely written expert stories on health that run through our various channels for them to talk about cardiovascular care or women's health. We have plenty of opportunities to reach key decision makers about the importance of various healthcare components, and we're continuing to grow that piece. The last thing we're doing is we think it's very important to honor and appreciate those in the community who've done best. Our events platform has become a very powerful way to connect a community. It's similar to the way the Health Connect South brings everybody here, which what Russ Lepari has done here has been incredible. We do it on a slightly smaller scale in various communities, and the healthcare community is one of our important things, doing a Healthcare Champions event every year where we bring together some of the people who are doing very special things in our community that aren't getting the proper recognition. We do best when we write about the underdog, because we write about the underdog who has not gotten any visibility. There's an appreciation that we're paying attention to the details and not just focusing on the top dogs in an organization. So I'm excited about healthcare coverage. I think there's a lot of opportunity there. It's so critical to our economy. We're going to continue to build on it.
And so what I'm hearing from all of you is the messenger is important, because you all are messengers as well as myself. That trust is important. You've got to have your readers and your followers trust, which means you have to be consistent, you have to be credible. As you like to say, David, you have to be disciplined and make certain that everyone always knows what type of product they're going to receive whenever they tune in, however they tune in to any of the things that you all are doing, including myself. So I appreciate you all today on this panel. I mean, this is a big topic, and we will continue to influence and drive some of the decisions of healthcare for better or for worse. So let us all remain disciplined and credible and make certain that we are a part always of the solution,
and
not the problem.
To you, Dr. Jane, thank you for what you do. Television doctors come in all different shapes and sizes in terms of quality, and what you have done has been tremendous for our community. So thank you for what you do, because unfortunately we have to get some of those other bad actors out of the way too. So
Thank you so much, and thank you all.